Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, COVID vaccines for kids. Dr. Megan Prochaska is a pediatric infectious disease specialist at Johns Hopkins. She joins Dr. Josh Sharfstein to talk about how COVID affects children and the benefits and risks of vaccination in 2025. Let's listen.
Dr. Erica Prochaska, thank you so much for joining me again here on Public Health on Call. I reached out to you because I know you are a specialist in infectious diseases in children, and there's been a lot of discussion lately about COVID in children and whether the vaccine is necessary. How are you doing today?
I'm doing well. How are you doing?
Good. I think it would be helpful if you reminded me and our listeners what you were up to during the pandemic.
Sure. So I started as a general pediatrician in 2019. And as everyone can recall, the pandemic started soon after that. So I was working as a general pediatrician at the very beginning of the pandemic, but prior to the pandemic even starting, had already been accepted to start a pediatric infectious diseases fellowship at the Johns Hopkins University School of Medicine, which I did start in the summer of 2020. And then the majority of my fellowship, which was more advanced training specifically in pediatric infectious diseases, was during the pandemic. Also during the pandemic, I had my second child. My first child was born right before the pandemic started. So I had the experience of being, a physician taking care of children during the COVID-19 pandemic, as well as being a parent trying to figure out, how to protect my children during it as well.
Talk a little bit first about your clinical experiences. What is COVID like in children?
So the symptoms of COVID can have a pretty wide spectrum. Some children do very well with it. And I think currently that's what we're seeing is that most children are getting sick for a couple days. The most common symptoms being cough, runny nose, fever, body aches, fatigue. Some children can get very, very ill with it, and are what we call critically ill, meaning that they need to be in the intensive care unit for things like breathing support with a breathing tube. And we did see quite a lot of that, unfortunately, during the height of the COVID-19 pandemic, 2020, 2021.
I remember reading about a condition that can happen after COVID infection, particularly in children. Could you talk about that?
Yes, so that is called MISC, which is, multi-system inflammatory syndrome in children. And that is pretty rare, but, was very scary to see at the beginning of the pandemic because we didn't really understand what was happening. But what we know better now is that, children were getting COVID-19 and then their immune system was getting so overstimulated from that infection, which may have not been a severe infection initially, but the persistent immune response to it, the immune cells getting really activated, then created this post-infectious inflammation that could make children very, very ill.
And what would that look like?
So what we would typically see is, children having fevers for several days, rash, red eyes often, and then when they would come into the hospital, they'd be very, very ill with low blood pressure that usually would require medications to keep their blood pressure up. Often their kidneys, heart, liver, other organs would be affected as well. And then we saw many children who actually had sort of, abnormal changes in the vessels that went to their heart as well.
Let me ask you this. When you think back to the pandemic, what is the image you have in your mind?
The truth is the majority of children who got COVID-19, stayed at home and did well. But we did see, unfortunately, children pass away, either because of COVID-19 infection, or because of MISC. And, we don't forget those children. As pediatricians, we don't see many children die. And I remember, each one of those kids who died from either COVID-19 related myocarditis, which is heart inflammation that was related to the virus, or children who died from MISC. it was a very scary time to be a pediatrician because we saw healthy children come in very, very ill and unexpectedly. And I don't think that I'll ever necessarily forget them.
If I'm getting your timeline correct, you were working in pediatric infectious disease when the vaccines became available for kids. How did that affect the number of children who were presenting with severe illness?
We definitely saw less children presenting with severe illness. And, what we saw clinically has been demonstrated in multiple larger studies that have shown that children were less likely to be hospitalized after COVID-19 vaccinations. There was some very nice data from, France that was able to use their national health system to show that, for example.
And how did vaccination affect MISC, that inflammatory condition that can happen to kids after infection?
So that actually also decreased. The study that I mentioned in France, showed that in particular that those who had 2 doses of the COVID-19 vaccine, were very unlikely to be hospitalized for MIS. The vaccine was an incredibly powerful tool to keep children and adults safe, to prevent people from getting severe infections, and also to decrease the spread of the virus in the community.
You mentioned that you had 2 kids during the pandemic. Did you apply your knowledge from the hospital to your own family? I'll ask it that way.
Yes, I did. Both of my children were, immunized for COVID-19 as soon as we could get the vaccination, which was challenging. I think probably a lot of parents listening can remember that, after the FDA approval, it was even hard to get the vaccinations in pediatric practices. But once we were able, my husband and I did do that, and that actually brought a lot of relief to both of us.
I can imagine. Now, since that time, we've had a couple more years pass. What's the picture of COVID in children look like in 2025?
So it is different than what we saw during the pandemic. We see a lot less children who are hospitalized with severe COVID-19. We do still see some children who are hospitalized with the infection. We still do see some children who have MISC. That is rarer than it was during the COVID-19 pandemic, but we can still see it happening.
So here we are a couple years later, and I wonder whether you still recommend vaccination for children.
I do still recommend vaccination for children. On the general basis that the vaccines have been found to be very safe, and they do prevent some of the rare severe consequences of COVID-19 infection. And so for me, it is the kind of ultimate risk-benefit decision of we think that the risk of a severe outcome from a natural COVID-19 infection is quite low, but the vaccine has been shown to be very safe. And so for me as a pediatrician, it is worth that to recommend to families to get the COVID-19 vaccine still.
I'm going to run by you some ideas that are out there among people who are not as enthusiastic, shall we say, about pediatric vaccination for COVID, vaccinating kids. Some people say that, well, maybe the only kids who should be vaccinated are those who have risk factors for severe illness. And you mentioned that you have seen some of those kids get quite ill. What do you think about limiting vaccination just to them?
I think that it's really hard to think through those hypotheticals without thinking about how they would actually be implemented, because we don't know what's going to happen in the future, right? So let's say theoretically that children, who are only deemed high risk could get COVID-19 vaccines. What if a child is not vaccinated because they're not deemed to be high risk, but then they get leukemia, which is a type of blood cancer, 2 months later, and they weren't?
And the risk is lower for kids without a known risk factor. Is it 0?
No, it's not 0. So, for example, there's not a risk factor necessarily that we're aware of for MISC, right? That has happened actually in children that have very robust, well-working immune systems.
So it sounds like you're saying 2 things. First, any child, even one that appears completely healthy, could be at risk for severe COVID. But also any child, no matter how healthy, could get one of these conditions that increases the risk, and it's better to be vaccinated ahead of that.
Yes, that's my general approach. I think that in, pediatrics, we love preventative care. And for me, it's about, preventing as much as possible any theoretical or real, risk that might occur. We of course hope that when we give a vaccination to a patient that they don't become immunocompromised in the future. But when we do see patients who are immunocompromised in the hospital and they have been fully immunized previously, that does provide us reassurance.
The question parents might have is, just how safe is the COVID vaccine? What gives you confidence that the risks are low so that the benefit of avoiding a rare but serious case is worth it?
So the most risk that we see from the COVID-19 vaccine in children is very similar to adults. So it's often fatigue, myalgia meaning muscle pain, sometimes a low-grade fever. Very, very rare reactions include, an allergic reaction or the myocarditis, the inflammation of the heart muscle. Those are extremely rare. And I think that if someone has already gotten the COVID-19 vaccine and has done well with it, we haven't really seen data to suggest that they may go on to have one of those reactions in the future. At least I'm personally not aware of that.
And then just talk to me a little bit more about the myocarditis, the heart muscle. There were some reports and evidence showing that there is an increased risk, albeit low, particularly, I believe, in adolescent boys with this. How do you think through the risk and benefit in that population?
So I think that it is something that is worth a pediatrician or, another physician discussing with a family, particularly if they're seeing an adolescent male that has, not had the COVID-19 vaccine in the past, because we typically saw it with the first vaccine or the second, when the vaccines were first being given to adolescents. At that time, there were analyses that found that the risk of myocarditis or inflammation of the heart muscle was higher from natural COVID-19 infection than from the vaccine, which is, why the vaccine continued to be administered. And it was interesting because the myocarditis that we saw associated with the vaccine was much less severe than what we would typically see with a viral-induced myocarditis.
Let me ask you about another idea that is out there, which is, it's much more serious to get COVID if you're old, let's say over 65, compared to if you're young, say under 12. And therefore, the focus should be on people who are older, and we shouldn't be worrying about vaccination for kids who are younger. How do you respond to that?
Infants are very high risk for hospitalization from viral infections. They're much higher risk for getting pneumonias and something called bronchiolitis, which is inflammation of the lungs from viral infections. So I think when we say young children, there's really such a spectrum of what a young child is. Certainly we do see infants that can be hospitalized with viral infections. I'd also say that in general, children will have much fewer consequences from an infection as an older adult. But what is the impact of preventing one of those very rare serious events like MISC from happening? We're looking at years and years and years and years of life that we want to make as healthy and happy as possible. So even though it might be a rare event, I believe it's still worth preventing.
Dr. Prochaska, do you think all parents should still be able to access the COVID vaccine if that's what they want to do to protect their children?
Yes, I think that parents should have the option, and I think that parents should also feel that they can go talk to their pediatrician or their family practitioner and ask questions about it and get information and have, free access to those conversations and that information as well.
Thank you so much for jumping on this podcast and answering some questions about pediatric COVID vaccination.
Thank you so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.